Hey, Dr. Todd again, talking about dealing with neck pain and some of the connections structurally to the neck that often get overlooked and not ever addressed is one, defining a structural problem. This is very common because of forward head posture, people sitting, looking at phones, maybe even traumas throughout their lives. We've talked about some exercises as part of our protocol. You're in our rehab area, and what you're seeing here in the background, setting Morgan up in a specific type of traction. Now, it looks a little bit medieval, but it is literally addressing her neck posture, okay? So when we lose the curve, the tension that builds up, the blood flow that decreases, the nerve flow that decreases, to be restored in order to get long-term relief out of neck pain. And one of the ways that we do this is through traction, okay? Now, what does traction do? Traction actually affects the spinal ligaments. There's big ligaments on the front, big ligaments on the back, and big ligaments in between each one of these bones. Ligaments, just like the ligaments in our teeth that can be corrected with braces, we do this with a specific type of traction. Again, don't try this at home. This is specific to her neck structure as identified on x-ray. But what happens is that we get a specific angle and a specific pull that the science has shown to correct over time this structural issue. So yes, we do some exercises for the musculature to be able to strengthen, but traction is a big component of this. Traction affects the ligaments. The ligaments start to permanently change with about 5 to 6 minutes, and the literature says 6 minutes worth of a sustained load, we can actually see some changes. How do we know though? We take a follow-up x-ray. After a certain amount of treatment, there's a follow-up x-ray that we're gonna do and measure the results. But oftentimes we can see inches of anterior head carriage or forward head posture change. We can see degrees of that cervical spine starting to come back. And the result, relaxed muscles, relaxed blood flow, relaxed nervous system, long-term pain relief by addressing the problem.